From the last class, okay, all of you please mute yourself. From the last class, we are discussing about assessment of growth in a child. Very important, class in pediatrics, and it has to be taught in the early part of pediatric lecture. That's what we are going to do, and we are doing here. Now, assessment of the growth can be done by body measurements. The first of that is weight. Okay. Second is a height or length. Now, there is a minor difference between height and length. Height can be taken only after the child can stand, and before that age, we call it length. Okay, so that is the difference between them. After the height, weight, and length, we measure head circumference, and head circumference should be measured routinely in every child before 2 years of age. Okay, some of the pediatricians even mentioned till 5 years of age head circumference should be measured, but specifically they should be measured before or prior to 2 years of age. Now, another is chest circumference. Okay, another is mid-arm circumference, then thickness of the subcutaneous fat. Okay, so upper segment to lower segment ratio. So all these are different parameter which tells us how growth is happening in a child. Okay, that's what we discussed in the last class. Let's move further. Now, related to the normal weight, see here, average birth weight in a child is 3 kg. This is the birth weight in a baby, 3 kg. This is average. It depends or differs according to the geographical location. Okay, in some of the country, the birth weight may be more than 3 kg. In some, a bit less, but this is the average one. But because of increased socio-economic status of all countries in all these days, the birth weight is slightly gaining higher and higher. Now, the baby, they lose their weight for a few days after birth and again regain birth weight in 10 days time. Okay, so this occurs in full-term baby, but in preterm baby, they lose more weight than the full term and then regain birth weight also later than the full term baby. So probably they may take around 12 to 14 days to regain the birth weight. Now, in 0 to 3 month, okay, in 0 to 3 month, the everyday weight gain is 30 gram. Everyday weight gain is 30 gram. So in first 3 months, if we ask you, okay, by giving the birth weight, what is the weight after 3 months, you can easily calculate now. So the roughly it becomes 1 kg gain per month. So in 3 months it would be 3 kg. So if a birth weight of a baby is 3 kg, then it would be 6 kg now. 3 kg at the time of birth and 3 kg after 3 months. So it would become 6 kg almost. Okay, so this is how you calculate. And after that, nobody is going to ask you in detail because up to 3 months is the important point. So this one you can see by yourself. See here, 3 months to 12 months, it is almost 400 gram per month. 1 to 3 years, 3 kg per year, and after puberty, 5 to 6 kg per year weight gain. Now, there is a small formula which is helpful for us sometimes, okay, so that we can quickly calculate it. Like weight at 5 to 6 months after birth is 2 times birth weight. Weight at 1 year is 3 times birth weight. So if a baby was 3 kg at the time of birth, okay, at 1 year, I would be quite happy if the baby becomes 9 or 10 kg. I'll be quite satisfied. This is the meaning. Weight at 2 year, okay, 4 times birth weight. 3 year, 5 times birth weight. 5 year, 6 times birth weight, and 7 year, 7 times birth weight. So this can be easily calculated by one formula, that is weight in kg equivalent to age in years plus 4 multiplied by 2. So let's do one exercise here, okay, the easy one. See here, Now, let's take the 6-year age. Okay, the baby is 6-year old. Now, if I want to calculate what is the weight of 6-year old baby, what is the expected weight? Okay, so let's use this formula now. Age in years plus 4. So 6, okay, plus 4 is equivalent to 10. Now I need to multiply that, okay, I need to multiply that by 2. So it would be 20 kg. It would be 20 kg. So I'll be quite happy if a 6-year-old a baby gains 20 kg at the end of 6 years. So see there. So this is the easy way of calculating weight. But this formula is applicable only till 7 years of age. After that, it doesn't, apply. Let's move on. Now, after weight, okay, there is one very important concept which is called weight for age. Now, weight for age means we ask what is the age of your child to the parents first, and they tell us certain age. We take the weight now, and we compare that weight of the child to the standard weight of that particular age. Now, you may be wondering from where we get that standard weight, isn't it? This is from the chart. Okay, this is from the CDC chart or NCHS chart. I'll talk about that a bit later. So what I'm saying here, for example, a 2-year-old child was brought to me. Okay, the mother said, my baby is 2-year-old, so I know the age now. So I will take the weight of that child in front of me, okay, in my clinic. So for example, I get the weight only 8 kg. Now I want to check whether that 8 kg is the normal weight or expected weight for that child or not. Now I need to check the standard weight for 2 years, and the standard weight of 2-year-old baby is 12 kg. Okay, I will get that from this special chart. Now 8 kg is far less than 12 kg, so I can clearly tell them, no, your baby is not up to the mark. Okay, your baby is malnourished, so you need to focus on proper diet. So this is the meaning of weight for age. Now see here. Okay, let's go to the slide now. This is the relationship of body weight for age, and we always have to compare with the standard data. Okay, and the standard data are there, you don't need to worry about them. This is one of the commonest measure of assessing growth and nutrition. This is an indicator of current or recent problem. What does that mean? If the child is not getting enough food, if the child is malnourished, if the child is ill or sick, the child will lose weight, and we can easily find out that by taking weight for age. But one of the important point, it requires the knowledge of accurate age. So age has to be accurate, and usually mother know the age. Okay, and if you still want to be sure, then you can ask the birth day, and from the birth day you can yourself calculate the age of the child, then there would be no confusion. Now, after weight for age, let's talk about what is height for age now. Okay, now see here. So height for age means we again ask what is the age of your child, then we take the height and we compare with the standard one. So length or height at birth, okay, it is 50 centimeter. At birth it is 50 centimeter. Now see here, this is the average one. Okay, some of the baby may be slightly lesser than 50, some may be slightly more than 50 also, but 50 is the average one. So you need to remember this. At 3 months the baby would be 60, at 9 months around 70, and at 1 year the baby would become 75 centimeter long. So this is a approximate gain in the length of the baby. At birth 50 centimeter, at 1 year 75. Okay. Now after that, okay, I'll directly move on to the 4.5 year. At 4.5 year of the age, the baby reach 100 centimeter. So these are the special point which your teacher may ask you. Now see here, this is one small formula which tells us what is the expected height up to 12 years of age. So if you can remember, it is good for you. This is height in centimeter, okay, and it is calculated by age in years, which is multiplied by 6, and we add 77 there. Now let me tell you one important thing here. Even if you don't remember this, no problem. For height also, we have got standard charts available, so we know the age of that child. So we quickly look what is the expected height of that particular age. For example, our child is 10 years old, so we see what is the expected height of 10-year-old child, and that would be the normal. So we compare what is the height of our child with that normal value. Then this is the way we find out whether it is within the normal limit or not. Let's move on. Now, what is the importance of this height for age? So height deficit reflects chronicity of malnutrition. So height doesn't decrease in acute or short-term malnutrition. Height only decreases when malnutrition becomes chronic or for a long duration. One small physiological point is there is diurnal variation of height up to 2 centimeter. Okay? Towards the evening time, the height is a bit lesser than in the morning time, and this is explained by the compression of the vertebra. Okay, throughout the day we keep on standing, we keep on working, we keep on walking, so there may be slightly compression of the vertebra, which can lead to decrease in height. This is not very significant. Now some of the people or some of the children, they have unequal leg length. One leg may be longer than the other. So what should we do during that time? So during that time, we should be the length or height should be measured in the longest leg. Okay, the longest leg is the proper height, and height may be recorded twice a year in the first 2 years, and after that once a year in an otherwise normal child. So this is all about the height for age. Now see here. After this, let's talk about head circumference, another important parameter to assess the growth, especially growth of the brain. Now at birth, okay, at birth, the head circumference is 35 centimeter. This is the average value, so you need to remember this. Now till 3 months of age, there is enlargement of the head size by 2 centimeter per month. Now let's quickly do one exercise here, because this type of exercise are very commonly asked in the exam. Now see here. So I will give this type of problem to you. This is a 3-month-old child, okay, 3-month-old child, and I'll give a particular head circumference at the time of birth. Let's say this is 36 centimeter. Now at the end of 3 months, what is the expected head circumference in this baby? Now how you calculate? See this, 2 centimeter per month. So 3 months, okay, 2 centimeter is 6 centimeter. So we add 6 centimeter there now. Okay. So it will be 42 centimeter. It will be 42 centimeter. So this is how we calculate head circumference after 3 months of the age. And this type of exercise can be easily asked to the student during MCQ exam or during Viva exam. Okay, so please be sure about it. After 3 months of the age, it is a little bit variable, so we don't ask these controversial type of questions. Now one very important point is, if the rate of the head is growing rapidly than that expected range, then hydrocephalus should be suspected. Now we all know what do you mean by hydrocephalus. Every student know that. Hydrocephalus is excessive collection of CSF in the ventricle of the brain, and that CSF is also increased in case in subarachnoid space. So in the ventricle and subarachnoid space, if CSF is increased than the normal, this is known as hydrocephalus. Hydrocephalus is one of the commonest cause of macrocephaly, especially before the fusion of suture. Let's move on. Now, there are some other measurements. You can quickly, look at these. Chest circumference is one of them. Okay. Proportional trunk and limb growth, which we call upper segment, lower segment ratio, and mid-arm circumference. These are the other. These are not very important in comparison to the first three, which we have just discussed. So, chest circumference at the time of birth, okay, is, see here, is lesser than head circumference by 3 centimeter. Means head is bigger at the time of birth. The diameter of the head is the biggest one in the body. That's why we say at the time of delivery, if head comes out, rest of the body will easily come out. Okay, so this is an important point to remember. So chest circumference is 3 centimeter lesser than head circumference at the time of birth. Chest circumference equals head circumference at 9 months to 1 year of age, and after that the lung growth, okay, exceeds the brain growth. So chest circumference will be more than head circumference after 1 year of age. Now, regarding the proportional trunk and limb growth, now it is known as upper segment to lower segment ratio. Now let me clarify this again for you. Now what do you mean by this? In the beginning, we take the height of the child. Then from the upper border of the pubic symphysis till the heel area, we measure the lower segment. Then when we subtract this lower segment from the height, upper segment would be there. Now we take the ratio. So what is the normal one here? The upper segment to lower segment ratio is 1.7 to 1 at the time of birth. That means the upper part of the body is bigger or longer than the lower part of the body. Okay, this ratio becomes 1 to 1 at 10 years of age, and after that it depends on the it depends on many factors actually. Okay, slightly the lower segment may be longer. Now mid-arm circumference is the useful measure of degree of malnutrition in the developing country, and this is mainly done by Shakir tape, and in Shakir tape there are different color. Okay, so accordingly we know which grade of malnutrition the baby is having. Okay, so this is about the mid-arm circumference. Now let's move on. Now we are going to talk about one of the very important part of this class, that is NCHS chart. Now the full form of NCHS is National Center for Health Statistics. National Center for Health Statistics. Okay, this organization belongs to United States. Now see here, these are called 1977 NCHS chart, because this was divided in way back in 1977. So this NCHS chart has different curve which may range from 5th percentile to 95th percentile. Now let me show you what do you mean by this percentile line or percentile chart. Okay, then I'll come back to this slide again. Now see here, all of you please focus here. Okay, this is a very, very important concept here in pediatrics. Now see here, so weight is given here. this is weight, okay? This is y-axis and here is x-axis. So in y-axis weight is given, and x-axis this is the age of the baby or age of the child. See here, at the time of birth, 3 month, 6 month, 9 month, 12 month, 15, 18, 21, up to 36 month. That means up to 3 years it is shown here. Okay. Now this chart is different for boys and girls. So this is the chart for the boys. Okay. So let's talk about this first, and then we'll go on to this another one. And this is the length. It's here. The upper one is the length. Okay. Age is same. This is okay length, and this is weight. After 2 years of age, I can call it height. Okay, I can call it height. Now see here, so how we use this type of chart. So let's say this baby is 1 year old, that is 12-month old. So the baby who is in front of us, who is the index child, okay, which child I'm examining right now, we take the weight of that child. The child is 1 year old and we take the weight in front of us. Now we want to check whether it is normal or not. Now see here, what is the expected or normal weight of 1 year old child? So see this, all of you please focus here. I'm sure you can see it on your screen. So what is the expected weight of 1 year old child? How much weight you can see here, this point? See this? Okay, almost 11 kg. It's almost 11 kg. Now see there. Okay, so this is the point. So I should see how much kg it belongs to. Okay, see here, almost 10. Okay, 10. It is 10. It is not 11. It is near to 10. So that 10 kg is the expected weight of 1 year old baby. Now, how much weight is our baby having? If it is near to 10 kg, we are quite satisfied. If it is not, we need to calculate what is the grade of malnutrition. This is called a proper or standard percentile chart. Now, okay, now you may be wondering, okay, what are the different percentile lines here? This is 5th percentile, this is 10th percentile, this is 25th, 50, 75, 90, and 95th percentile. Now, if the weight of a baby is between 5th percentile and 95th percentile, we still consider it normal. We still consider it normal. Please mute yourself. Mute all of you. Okay, but if the weight falls below 5th or exceeds 95th, this is abnormal. Probably exceeds 95th is a feature of overweight or obesity, and falling below 5th is a feature of malnutrition. The same thing applicable to the length. Okay, now see here, so this is the meaning. So similarly, the NCHS has devised curve or chart for weight for age, height for age, weight for height, and height for head circumference for age as well. Now, these are very easy for us to understand, but there is one important concept which is known as weight for height. Now, listen carefully. What do you mean by weight for height? Now, weight for height means we take the height first, and we check what is the weight for that particular height. Is that weight normal for that height or not? So let me explain by giving one example to you. In your class, probably many of the students are of same age. Okay, they are probably 20 years, 21 or 22 years. Okay, but their height is different. Many of them, okay, are taller. Some are of average height and some are a bit shorter also, but they are of the same age. Remember this. So the concept of weight for height comes here. So a tall person should have slightly more weight for that particular height, and a short person should have a bit lesser weight for that particular height. So this is the concept of weight for height. Now, when the growth parameter falls below the 5th percentile, it is known as malnutrition, and we calculate the percentage. Accordingly, the malnutrition is classified, and these are different types of classification. See here, this is normal. If it is more than 90 according to Gomez classification, it is normal. Waterloo classification is about height for age. More than 95% is normal, and Waterloo is also used for weight for height. So more than 90 is also normal. So these all are different things which I will extensively teach you in a topic of malnutrition. Okay, this is just a beginning for you. This is a little bit confusing, I know, but don't worry. This is just a beginning, and at this class, I want to just explain what is the meaning of this percentile chart. Once you understand this, all these exercise and things we will discuss in a malnutrition class. Now, we have come towards the end of this topic. At the end, some abnormal things would be discussed. For example, what are the causes of increased weight in a child, and what are the causes of decreased weight in a child? See here. So these are the causes. Endocrine disorders like hypothyroidism, growth hormone deficiency, Cushing syndrome or Cushing's disease, and hypogonadism. These are the common causes of increased weight in a child. See here, these all are endocrine disorders. So hypothyroidism means decreased thyroid hormone level. Growth hormone deficiency is a very common cause of dwarfism. You must have heard this term dwarfism because of decreased growth hormone. Cushing syndrome or Cushing's disease, this is decreased level of increased level of glucocorticoid, increase, okay, not decrease. It's always increased level, and many of the time the disease starts from the adrenal gland, but sometimes the disease also located in pituitary gland. Hypogonadism is the decreased level of sex hormone. Now, another important cause of here obesity or increased weight are thalamic or pituitary disorder. One of the condition is known as Froelich syndrome. This Froelich syndrome is characterized by obesity as well as hypogonadism. Obesity as well as hypogonadism, Froelich syndrome. Now, some of the genetic disorders also have obesity problem. They are Prader-Willi syndrome, okay, and Lawrence Moon Biddle Bardet syndrome. Now these are difficult conditions for you, okay, and at undergraduate level nobody is going to ask in detail about these genetic disorders because they are quite rare and they are not for your level. So if you just remember the name for these different causes of obesity, that will be more than enough. Prader-Willi syndrome is characterized by obesity, a bit of mental retardation, and hypogonadism once again. And Lawrence Moon Biddle Bardet syndrome is associated with blindness and obesity. Okay, again some problem with hypogonadism may occur there. Now, on the other hand, what are the causes of decreased weight now, also known as wasting? Now, see here, these are easy for you to understand. Undernutrition or malnutrition, probably the most common cause. A few examples are kwashiorkor and marasmus. Kwashiorkor and marasmus. That will be a special topic for us later on. Psychosocial deprivation. Now, the meaning of that is inside the family, if that environment, okay, is not good enough. For example, the relationship between parents and the children is not good. The relationship between father and mother is not good. There is quarreling all the time. There is fight all the time. There is some sort of mental torture all the time. The baby will not grow properly. This is called psychosocial deprivation. Hyperthyroidism, okay, is one of the condition where there is decreased weight. See there, hypothyroidism is a condition where there is increased weight, And hyperthyroidism is the condition where there is decreased weight. Now, one important explanation I want to give you here. In hyperthyroidism, there is increased basal metabolic rate. So there is increased consumption of energy or calorie. We burn more calorie. So there is decreased weight. But in hypothyroidism, the basal metabolic rate is decreased. We don't burn more calorie. So all the calorie will be collected in the body, resulting in increased weight. Now, iron deficiency anemia is another cause of decreased weight. Failure of a major organ system like kidney failure, okay, liver failure, even chronic heart failure. Lead intoxication. This lead is a heavy metal. Okay. HIV infection, HIV and AIDS, very important cause of wasting. Immunodeficiency disorder, because of repeated infection, the child will lose weight. Inborn error of metabolism, these are amino acid disorders, and genetic disorders like Down syndrome. So all these are important types of, or important causes of decreased weight or wasting in a child. Now let's move further. Now similarly, what are the common etiology of change in head circumference? Okay, there are only two conditions, either increase head size or decrease head size. So let's talk about that. See here. Okay, increase head size. These are the common causes: hydrocephalus, thick skull bones, porencephaly or hydrancephaly, and megalencephaly. So let me explain a little bit about them. So every student know about hydrocephalus, but if hydrocephalus occurs at the time of birth or very early in life, we think about congenital type of hydrocephalus, and these are the common causes: Arnold-Chiari malformation, Arnold-Chiari malformation, and aqueductal stenosis. Now, which aqueduct is this? Can you tell me the full form of this aqueduct?
Aqueduct of Sylvius, which connect the third ventricle to the fourth ventricle.
Absolutely. Absolutely. I'm sure many other students also know this. Okay. This is one of the pathway of CSF flow. This is a cerebral aqueduct of Sylvius, which connects third ventricle to the fourth ventricle. And this is a very small, channel. So it can be blocked quite easily. So if it is blocked, it can lead to obstructive type of hydrocephalus. Now, Arnold-Chiari malformation occurs, okay, at the region of fourth ventricle. It is associated with cerebellar problem. Okay, so there will be, hydrocephalus. Another important cause is thick skull bone. Common disorders are achondroplasia and osteopetrosis. Now, achondroplasia is a quite interesting sort of condition where there is no development of cartilage. See that achondro means absence of the cartilage. Now let's remind you one important point. Whenever we talk about growth of a long bone, okay, now towards the end of the long bone there is epiphyseal plate of cartilage. If that epiphyseal plate of cartilage doesn't develop properly, then bone cannot grow. The height of that person will be very short, and this is known as achondroplasia. Along with the short height, the skull bone is also become thicker in that person. Osteopetrosis is a type of bone disorder, okay, where there is faulty type of bone resorption. There is increased bone deposition but faulty type of bone resorption. So here and there the bone, okay, gets increase in diameter. If same thing happens on the skull, okay, skull will become thicker. Osteopetrosis. Now remember, those bones are not stronger. Okay, there is a haphazard type of accumulation inside the bone. Others are porencephaly and hydrancephaly. Porencephaly and hydrancephaly. Now, porencephaly means there is a cyst formation inside the brain. This is a congenital condition resulting in increased head size. And hydrancephaly is a very interesting sort of condition where there is no brain, there is no cerebral hemisphere. Now, what is there in the place of cerebral hemisphere? There is only CSF. So, the CSF is present in the place of cerebral hemisphere. So, this type of condition is very commonly confused with hydrocephalus, but this is not hydrocephalus. This is entirely a different condition. In hydrocephalus, there is brain, there is normal cerebral hemisphere. It may be atrophied, that is different thing, but it is there. But in hydrancephaly, cerebral hemisphere is absent. It is diagnosed with the help of CT scan. And another condition is known as megalencephaly. Now, megalencephaly means big size brain itself. Mega is big, encephaly is the brain. So these are some conditions for that. Neurofibromatosis or tuberous sclerosis, both of these are genetic condition which may run in the family, and brain may be bigger in size. And another is some storage disorders. Okay, some of the storage disorder like a lipid storage disease. Okay, one of the example is called Krabbe's disease, where there is abnormal type of substance deposited inside the brain and the overall brain looks bigger in size. So these all are called causes of macrocephaly. Please remember, macrocephaly means big size head. Hydrocephalus is one of the cause of macrocephaly. Let's continue. We are talking about a different abnormal condition where there is change in head circumference. Now, let's talk about what are the causes of decreased head size. When head size becomes small, this is known as microcephaly. Microcephaly. So what are the causes? See here. The first one is familial microcephaly. Familial. There are so many family where all family members have very small head. Okay, this is familial microcephaly. But please do not think there is a decrease, intelligence in them. All of them can be highly intelligent. So that's why it is known as familial one. It is not a pathological. Another condition is craniosynostosis. Craniosynostosis means there is early fusion of suture. The suture is the joint which is present between the skull bone. So if that suture, okay, is fusing quite early, then our brain cannot grow properly. Okay, so this results in decreased head size. Prenatal insult means at the time of pregnancy or during pregnancy, probably there is some damage of the fetal brain. Okay, and brain becomes smaller because of the prenatal damage or insult. Then head overall will become small because head size is determined by the brain growth. So this is quite important point. Maternal drug or alcohol abuse is one of the cause. That's why these things are strictly prohibited during pregnancy. Intrauterine infection like TORCH group of infection, again the same things comes. TORCH group of infection, if the student know by now. Complications of pregnancy or birth like prolonged labor, obstructed labor, which leads to birth asphyxia. Okay, birth asphyxia means there is hypoxic damage to the brain, so brain cannot grow properly later on, resulting in small head size known as microcephaly and some of the chromosomal defect like Down syndrome. Again, these are some of the causes. Okay, all these questions are quite important, especially from the exam point of view. Now, the last part of this assessment of growth topic is what are the abnormal conditions which leads to increase height and decrease height. Now, increased height may be seen in excessive production of growth hormone. excessive production of growth hormone. Can anybody tell me what is that condition called when growth hormone is produced excessively?
Acromegaly. Like acromegaly or gigantism.
Very good. Okay, I got the answer already. Many students have told that it is gigantism or acromegaly. Gigantism or acromegaly. Now see here, I'm going to write that for you. Gigantism, okay, or acromegaly. Very good. Now, gigantism occurs before the fusion of epiphyses, so it occurs mainly in children, and acromegaly occurs after the fusion of epiphyses. So there will be no gain in height in acromegaly. There is only gain in width, okay, or breadth in the bone. All the organs can become bigger in size, but the person is not tall anymore. He has already gained his height, and the height is not going to increase after that in acromegaly. But in gigantism, because the epiphyses still have not fused, there is a big scope of gaining in height, and these people are quite tall. Now this growth hormone is, okay, produced by anterior pituitary. Everybody know that. So if there is any tumor in anterior pituitary which produces increased level of growth hormone, these are the conditions which result. Another condition is hyperthyroidism. Okay, hyperthyroidism. The child can become tall here, whereas in hypothyroidism the child would be short. So exactly opposite. Here hyperthyroidism, okay, there is gain in height. In hypothyroidism there is stunting. Klinefelter syndrome, okay, Klinefelter syndrome is a condition where there is hypogonadism, okay, is a chromosomal abnormality where there is hypogonadism, there is a very tall stature, okay, slightly mental retardation, not that much, very slightly mental retarded, and there is usually sterility, that person cannot become father because the testes are atrophied, they are not working, and most of the sexual characteristics, okay, are there of the girls because of the failure of testicular development, because of the decreased level of androgen hormone. The estrogen hormone will take over, and secondary sexual characteristics are there which belongs to female. This is called Klinefelter syndrome. Now tell me, what is the karyotype of Klinefelter syndrome?
So it is a male, sir.
47 XXY.
47 XXY, sir, male.
XXY.
47 XXY. Excellent.
47 XXY male.
Very good, very good. Whenever there is Y, okay, the sex is male, there is no doubt about it, okay. So it is 47 XXY. One X chromosome is extra, and this is what causing all the problem there. Now, Marfan syndrome is a condition, okay, autosomal dominant disorder which runs in the family. Here the person is quite tall, especially the arm span is more than the height. The arm span is more than the height in case of Marfan syndrome, and it is also associated with some other abnormality, okay, some other abnormality like aneurysm formation inside different arteries, aneurysm formation, okay. Then mitral valve prolapse is one of the conditions which is associated with Marfan syndrome, and one more, okay, the lens of the eye is usually dislocated in Marfan syndrome. So these are some of the important points. So this is the way I teach my students. So if you listen this, even if you miss some points there, please repeat this video which I load definitely in YouTube, and from there, okay, you can repeat these things. Okay, homocystinuria is a disorder of amino acid metabolism where there is increased height, okay, homocystinuria. Soto syndrome, okay, is another condition where the person is quite tall and there is abnormality of the brain. Usually brain is slightly bigger in size, it also leads to mental retardation, Soto syndrome. Congenital adrenal hyperplasia is a disorder of adrenal gland. In this condition, there is some enzyme deficiency occur, and those enzymes are very much essential for the synthesis of glucocorticoid and mineralocorticoid. Okay, so let me write those enzyme there. Maybe some of the students know what are those enzymes which are deficient. Anybody?
21
It's
hydroxylase,
21 beta hydroxylase and 17 hydroxylase.
Very good. 21 hydroxylase. Okay, 21 hydroxylase is the most common enzyme which is deficient in congenital adrenal hyperplasia. Okay, after that 11 beta hydroxylase is the another one. So that is less important. In the exam we all the time ask about 21 hydroxylase. Excellent. Now what's the problem here? Because of this enzyme deficiency, the glucocorticoid and mineralocorticoid cannot be formed properly. So most of this pathway is diverted towards sex steroids. And as a result of that sex steroid, okay, there would be increased height. Premature sexual maturation means the secondary sexual characteristics are developed quite earlier than expected. Maybe at 8 to 10 years of age, okay, there is gain in height. Okay, the development of gonad would be there. The secondary sexual characteristics like axillary hair, pubic hair, enlargement of the penile, penis or penile length. Okay, everything is happening quite early than expected. This is called premature sexual maturation or precocious puberty, you can say. Now, on the other hand, okay, what are the causes of decreased height or stunting? Now, all of you, please focus there. See here, one is familial. Okay, nothing wrong. All the members of the family are short, so this child is also short. So we need to take a good history. What is the height of the parents there? Okay, what is the height of the siblings there? So this is familial stunting or decreased height. Another is called constitutional. Now, this is a very interesting mechanism. Constitutional means before the puberty, the child is usually short, but at the time of puberty, the child suddenly gains height. And after that, it will become normal. This is called constitutional growth delay. Growth hormone deficiency, one of the important cause of stunting. This is called dwarfism. Okay, dwarfism is a very important term which is used for growth hormone deficiency. Hypothyroidism, never forget this. Extremely important causes of decreased height. And one important point, in hypothyroidism, the limbs are more shorter than the trunk. So this is disproportionate type of shortening. The limbs are more shorter than the trunk. Chronic anemia or any chronic disease like intrauterine infection as well. Any chromosomal disorders like Down syndrome, Turner syndrome. Okay, Down syndrome every student know, but Turner syndrome is also a very important cause of decreased height in girls because Turner syndrome occur in girl, and the karyotyping is 45X. Very good.
Absence of one chromosome.
Excellent. Absence of one chromosome, so only one is there, so it is 45X, or you can call it 45X not. Okay, not means it is absent. Now, another cause is failure of a major organ system. Okay, heart failure, kidney failure, liver failure for a long time, it's a chronic condition. Another may be rickets or skeletal dysplasia because of vitamin D deficiency. And the last one, just like decrease in the weight, decrease in height can also occur in psychosocial deprivation. This is, the unhealthy environment inside the family. Okay, there is all the time stress, there is all the time fight. This type of environment is never good for the proper gain in weight or the height. So these are the important slides, the last few slides from this topic, and if any question comes from this topic, these are the ones for you. Now at the end, okay, I have comprised some questions for you. These questions will be given as a homework later on, okay, so you don't